welcome to Birth Chat. This week I wanted to talk to you about our attitudes to birth. This is something that a nurse actually raised to me that I was able to work with when I went to her birth, and it was the feeling for her that when she went into hospital, she went into patient mode. From being a nurse where she went into professional mode every time she went into hospital, she had a kind of way that she expected a patient to behave, and a kind of understanding of that, and she wanted her birth to be different to that when she went into the hospital setting. Something that she was really aware of happening was not going into patient mode. When we go to have our babies, we are not patients, we are having a baby, and we have chosen our place to birth. So even if it's a planned home birth, we can still have a really good plan for how we want to do things if we go to hospital, or if we later on in pregnancy know we're going to go to hospital. A really good thing to do is to familiarise yourself with the types of procedures and policies that are going to happen in hospital, and to make your choices beforehand of what you're comfortable with, what you're absolutely not comfortable with, as in what are your deal breakers, and at what point are you happy with what thing. Something that's really helpful for this, we have an acronym that we use in hypnobirthing called BRAIN, so you might have heard it. I'm going to go through that with you later on in the episode, but it's really helpful for giving us time to stop and think about what choices we're going to make, given the circumstances at the time, because birth is an ever-changing situation. So the first thing I want you to think about today is who is having your baby. It can be really tempting to go into hospital and think, I'm going in, everybody in there knows what they're doing, they do it every day. I don't do this every day, so I don't know what I'm doing. Okay, that statement in your head and that self-talk is going to put you into a different position straight away. It's going to put you in a position where you're waiting for someone else to tell you what to do, when actually in birth you need to be listening in to your own self to find out what to do. There will be times where you do require some help, and you know that, and you will hear that from it within yourself, and you will know to ask, and that will be the right time. There'll also be times where you're perfectly able to manage yourself, or to know what you want, which might be that I want pain relief right now, and you're able to ask for that and say that, and that's perfectly fine. When you arrive at hospital, you're going to be seen in triage normally by a midwife who's there. Though they will take you through the procedures for getting into your birthing room, so there can be a wait when you arrive to the hospital before you get into your labour ward room or your birthing centre room. So during that time, what's going to be really important for you to do is to familiarise yourself with the area and find your comfort spot, and that's really important. You also can then work from there as to being really confident in saying how far along you are. So even if you don't know, and you probably won't have taken any measurements or anything yourself, if you feel like the baby is coming, it is perfectly okay to say that and be vocal about that. You could also, if you're not sure, if you're really not sure, is to find yourself a really comfortable position and place and do your breathing exercises. If you're in a bed on triage, a really good idea would be to have headphones so that you can't hear what else is going on around you, and so you can focus in on what's happening within. So take some headphones, take some snacks, because you may be waiting in triage for some time. And in that time, it's just going to be really important to listen in, focus in, you're going to be offered some different types of procedures. So firstly, you'll be offered an assessment to see how far along you are. Generally, this is accepted and fine. If you're not comfortable with anything, please do say so. You're totally allowed to decline anything that is offered you, or to ask to wait for more time if you prefer. This can go for being checked if your waters have broken, or having your cervix measured. Those things can wait. They're generally the normal procedure, but you can ask for some time on those, and that's fine. Once you arrive in hospital, the normal protocol for getting your labour room is to be 5 centimetres dilated. So again, that's something that most mums want to hear, that they've hit that mark, and that's absolutely fine. Once you get there, you can go to your labour room, and from 5 centimetres onwards, you should be able to get pain relief if that is what you want. Something that mums find really empowering is to have the midwives not offer them pain relief and have them ask instead. And the reason why that can be really helpful is because, again, it's that getting out of patient mode and allowing yourself to be the one who decides what it is you want and when you want. Your sensations might appear to be really strong from the outside, and you're not necessarily going to be worrying about what you're doing, but your midwife might look at you and say, oh, okay, it might be time for you to have pain relief. Whereas from the inside, you might be conflicted and saying, well, actually, that's not how I feel. I don't really want pain relief. Do I need pain relief? But now we've had the suggestion of pain relief, we'd start to think that's what we need. So it's really good to be clear on what we want, when we want. And our midwives really benefit from us being able to say what it is that we want, because then they know. So something that you could put on your birth plan to that effect is, I'll ask for pain relief when I want pain relief. And that is just, it puts you on a really powerful footing and in control of the situation. If you are offered any other procedures, for example, waters breaking or different types of pain relief, the best thing that you can do in that situation is ask for a moment, especially if you're in the middle of a contraction, is ask for a moment and just think about what has been asked of you. You can talk this over with your birth partner if your birth partner's there. I know things are a little bit different at the moment. If not, it's perfectly fine to ask for the circumstances to be explained to you, and it's perfectly fine for you to say no, or to ask what happens if we leave it a little bit longer. So again, this puts us, the birthing mum, in control of the situation and allows us that bit of thinking time to make our decisions. It's not to say that we're not going to agree and we're not going to go ahead with whatever help that we might need, but it also gives us a chance to think about whether we do need help or whereabouts we think we're at. I've known mums that have sat there and gone, okay, I'm going to have a section if I don't get to 10 in the next few minutes, and they've been told they're a 4 or a 5 and there's pressure from the outside to do what they have to do. And honestly, it's just about checking in with yourself and thinking. And I've known mums go, right, I don't want to have a section, which is perfectly fine, so I'm going to be a 10. And just that quickly and just like that, that's what happens, and they're pushing their baby out. So it's a lot of it is going to be in your mind, a lot of it is going to be dealing with the outside pressure of being kind of told what to do, and it's going to be taking the advice on board and filtering it out and using what's helpful to you, and then working with what your instincts are telling you. When you do arrive in the birthing room, most of us have never been inside a birthing room, and we're certainly not allowed to do tours at the moment, so I'm going to talk you through what you might see in a typical room. I do have a picture, a couple of pictures that I'm going to put on in here to show you. What you're going to see is some monitors. So you're going to see a monitor that deals with your heart rate, baby's heart rate, and your contractions, okay? And what's going to happen is that you've probably been in triage on a trace. So you're going to have had 2 straps over your belly with holding on 2 little electrodes onto your tummy, and what they're going to be doing is taking the baby's heart rate and tracking your contractions in those little peaks. Okay. So that's what you're going to see. You're going to see one of those machines again. You're going to see a great big birthing bed, unless you're in a birthing centre, in which case you might find a birthing pool, a birthing ball, and a great big kind of spongy thing which you can use to lean on or whatever. So the birthing bed is going to be like a normal hospital bed, but hopefully you'll get some extra pillows on there. But I do always say, please remember to take pillows with you, because you might find that you can't get an extra pillow, and that's just kind of annoying when you're trying to have a baby. So bring pillows. Also, you're going to have an ensuite bathroom, so you'll have your own toilet in there, so don't worry about privacy, anything like that. You will be able to get off the bed and use the toilet and come back to the bed again, even if you're on a drip. So you should be able to get down and come back. The only time you won't is once you've had an epidural, so in which case you would use a catheter. You will have space in your room for your partner to sit. There's going to be a really uncomfortable chair for them to sit in. They won't be able to sleep on it. Dads may want to bring something that they can sleep on. I've had dads bring sleeping bags before. Great idea. You're going to have 2 midwives assigned to you. One is going to be assigned for the labour, and she will be your midwife until shift change. And there'll be another midwife who arrives when the baby is arriving. So your midwife will tell the second midwife that baby's coming, and then she'll be there for baby. So just like a home birth, there'll be 1 midwife for mum and 1 midwife for baby. And you're also going to see a cot with a warmer for baby to lie on. That space is safe for baby to be resuscitated if anything's needed, but it's also where you can leave baby to sleep. And nothing else will probably be in the room other than maybe a desk for the midwife to write up notes. So you should have space to walk around the bed and make yourself as comfortable as possible. You may want to bring pictures, you can bring battery candles, you can bring all different things to make the room feel as comfortable as possible. And again, this is a really good way to feel in control of the situation once you're surrounded by things that are familiar to you. So it might be pictures of your children, it might be your family. Another push for the pillow here is bringing a pillow, because it smells like home, and anything that feels familiar is just going to be really great for encouraging your birthing hormones to work and bring those contractions on. So here I'm going to talk you through the BRAINS acronym, and this is just going to be really helpful when you're making decisions and you're faced with decision making during labour. So the B stands for benefits. So the first question that you're going to ask when offered a medication of any kind or an intervention of any kind is, what are the benefits? And there's generally going to be an explanation given to you there. For example, let's use breaking your waters as an example. It might be to move the labour along more quickly. It could be that you feel like things aren't really moving along. It could be that the baby's heart rate is changing a little bit, and they're just a little bit concerned and want to move things along. So you can ask, what are the benefits of this procedure? Is this procedure going to have the desired effect? Is it going to speed up my labour? And why would I choose this particular procedure? And in which case you will get a good explanation and understanding, and again you will feel so much more in control when you understand what the benefits are. The R and the next question is, what are the risks? It's very unusual for a procedure to come with completely risk-free, because anything that touches us or distracts us from our labour can really change the course of how things are going, for the good or for the bad. So it's really important to ask, what are the negatives? Are there any risks? And what will be the consequence of those risks? For example, should you break waters and the baby doesn't seem to respond well, this could end in an emergency section. So it's just knowing what is the following step, what's the next step that could happen, and then you've got a good footing for making your decision. The A is going to be for alternatives. So is there anything else we can do? And you've got time, even when it gets really crazy and people turn up in the room and ask you questions, you still have time to ask, are there any alternatives? You don't always have to go with the first option. Generally at this point, when you're offered different things, there's very highly trained and skilled doctors and registrars in the room with you, and they will have a lot of ideas of how things can work. So don't be afraid to ask, what are the alternatives to this? Once you've got all the information, and it can come at you very quickly, so that's okay. If your partner's there, have a chat and go through what you're thinking. The most important thing here is, what are your instincts telling you? For a lot of mums, if we get to a stage of people coming in and making suggestions about treatments, baby is very, very close, or mum makes a decision that baby is going to come before all of these things happen. So check in with your instincts, take some deep breaths, have a think about what is going on for you. Do you feel like you're going to need this help? Do you feel like perhaps baby's not moving, baby's a little bit stuck, or do you feel like maybe baby's just right around the corner and everybody's kind of in a hurry and you're not in that much of a hurry, and that's also fine. So really check in once you've checked on the benefits, the risks and the alternatives. Check in with yourself and with your instincts and see where you're at. In brains, your N is for nothing. So after we have worked out what our instincts are telling us, we can then ask, what happens if we just do nothing? And I know that's kind of an odd question, and it will often stump our healthcare providers because they're not used to that question. Usually once a health provider gets involved, they are expecting to have to do something. But it's also okay if we do nothing, and it's really interesting to hear how your care team might respond to that question. Oftentimes, when we do ask it, the response is something like, let's wait, let's give it half an hour, let's give it a little bit longer, and oftentimes that is all that mum and baby need to have a really clear notion on what the best steps are to take next. And finally, the S for brains is just to smile. I know that's kind of a weird thing to say for during birth, and it might be your partner that has to smile, but honestly, just taking that time to kind of look around and realise that everyone in the room is on the same team brings everyone together, and everyone just feels so much happier. So smile, relax, and know that baby will be with you in a very short time. I really hope that helps you with your decision making. So I'm really excited to hear what you guys have to say. I don't know if you guys have been in this experience, what you guys have chosen. So please like and comment and subscribe and tell me how you guys feel about this.